Hi, my name is Adriel William, and today's video is regarding ethical scenarios that are usually asked in any dentist school interview. I personally have been part of 6 interviews, actually 7 now as a candidate, and I observed almost in all of them, they will ask you in one way or another about critical thinking or ethical scenario. And the reason they are asking you is because they want to know if you know a little bit about what's right and wrong in the US society. Because one of the things that you might want to know that ethics keep changing in every society over time. And I'm not going to go into much detail, but I made several other videos. I'm going to share them in the link. You can watch them as well. Now, the reason I made this video is that I've observed over time that ethical scenarios have kind of like a pattern. There are some things which are common, and you can figure out which way the answer should be going. I'm not saying there's a fixed template when you're answering any ethical situation, because you can get yourself in trouble. I know candidate who would call me or ask me if there's a fixed template to answering questions in the ethical scenarios, and I usually recommend not to look for a template, otherwise you will get in a problem. It's more like a critical thinking. But the pattern I have observed over time, I'm going to try to explain it with an example. So there are some situations that I would say are red light situations, and some situations are yellow light. So red light situations are problems where you should inform your supervisor, administrator, or your faculty right away. For example, number one, if you have a colleague, a staff member, a friend who's actually cheating in an exam, that's considered to be ethical misconduct. And if this is asked, I believe you should be informing your supervisor right away about that situation of cheating in the exam or the test. Second, if the person, your colleague or a staff or any provider is coming drunk or intoxicated to the clinic, that's a situation which is highly critical and cause, I believe, a high threat to the patient or even to the provider, him or herself. So that has to be informed right away. So these are red light situations. Third is if somebody is doing an insurance fraud, or somebody is reusing needles or instruments that could be really harmful. So these kind of situations would be considered to be a red light situation. And obviously the situation could vary a little bit, but you need to understand which is a critical situation where I need to inform somebody in the authority right away. The second situation that I would call are yellow light situation. These are situations where you see a problem which is not highly critical. For example, I was asked in some of the interviews that if one of your friends is not wearing the PPE during COVID or not wearing the mask properly, I would say in this kind of situation, I would go and talk to that person and I will ask them if they know about the latest protocols, if they are aware about the latest mask or the PPE, or do they even know how to wear them properly. And if not, I will try to help them. But if that person consistently continue to overlook and be sluggish or slack in that situation, then I would inform my supervisor. In the same way, if somebody is not wearing the proper attire in the clinics, yes, maybe I can go and discuss with that person, and if he continues to do it, then maybe I should inform somebody. In the same manner, if somebody is not giving the proper oral hygiene instruction to their patient, they are overlooking at it or they are trying to run away from it and slacking in their work, then maybe I need to talk to them. Maybe they need help, and after help, they might be fine. You don't have to be a snitch and go and tell everything to your supervisor right away. Yes, if you feel this is a critical situation and this person is continuing to do it intentionally, then you should. So this was kind of like a pattern I thought about this over time, that you could actually figure out any situation that is given to you where it is a critical situation, which is like a red light for you, and you have to inform right away. And then you should be wise enough to understand that some situations could be a yellow light where somebody is not intentionally doing wrong but might be ignorant about their act. So you can actually talk to them, inform them, educate them, and then realize if this person continue to do this, you might have to inform somebody. I hope this video helps you. You can like and subscribe to my channel. If you want in-depth training or help with your interviews with ethical scenarios, I've been helping candidates in the past 3 years, and I think it's wonderful for me and I hope for them as well. But if you want to learn more, you can reach out to me, contact me, and you can watch more videos on my YouTube channel. Do like and subscribe to the channel, and I hope I'll see you in a more meaningful video. Thank you.